If you want to know how to differentiate between implantation bleeding and the actual period, this video is for you, because I want to explain to you the 3 cardinal signs or the 3 features that you should look out for, so that you can comfortably say and confidently say that this particular bleeding is implantation bleeding and not your normal period. And this will help you to be very accurate when you are telling your doctor your last menstrual period, which will be used in the calculation of your due date, so there will be no error in that calculation. Okay, so your implantation bleeding is the type of bleeding that happens when the fertilized egg has moved from the fallopian tube and goes into the womb, where it will implant on the wall of that womb. So during that implantation, there is small amount of blood that comes out from the womb. Okay, and that blood coming out is what is called implantation bleeding. All right, so there are 3 features, 3 basic features that if you are aware of and you look out for them in your bleeding, you will know that this particular bleeding you are having is implantation bleeding, or it is your normal menstrual period. So for your implantation bleeding, the color is always lighter than usual, always lighter than your normal period. Okay, then the implantation bleeding also has a shorter duration than your normal period. Now, if your period is usually 4 days, you are very certain that it's 4 days. Any kind of bleed that you're having in a month that is shorter than 4 days, let's assume it's 2 days or 3 days, it has qualified on the aspect of duration. Okay, because it's shorter than your usual period. Now, if that bleeding is also lighter, it even makes it more qualified to be called implantation bleeding. So that is the number 2. Then the number 3, the last one, is that implantation bleeding doesn't flow as much as your normal period in terms of volume. So the amount you are going to lose when you are having your normal period is always going to be more than the amount you will lose when you are having implantation bleeding. Okay, so during each menstrual period, there is a certain amount that you are going to lose. Okay, now when you notice that this particular time that the amount you are losing is less than the usual, far way less, that it is obvious that you noticed it, it also makes it possible that what you have is implantation bleeding. Okay, so when you put these 3 features together, and it is 3 of them in one particular period or in one particular cycle, then you know that it is most likely implantation bleeding and not your normal period. So these 3 features are the volume, the color, and the duration. So if the volume is less than normal, it is most likely implantation. If the color is lighter, it is most likely implantation. And then if the duration is shorter, it is most likely implantation. Okay, so the reason why this video is very important and why you should know this and always have it at the back of your mind during each menstrual period is because the implantation bleeding in most cases occur at around the same time when you are supposed to have your normal menstrual period. So you might even mistake it for your normal period while you're already pregnant. If you got any value from this video, please hit the follow button now, share this video to as many friends as possible, and I shall see you tomorrow.